What mechanisms allow strep throat to escape our immunity? Imagine a tiny bacterial army trying to hide from your body's immune defenses. That's exactly what the bacteria causing strep throat, known as Group A Streptococcus, does to survive and cause infection. These bacteria have developed clever tricks to avoid being destroyed by your immune system, making infections sometimes stubborn or recurrent. One key way they do this is by attacking the antibodies your body produces. These antibodies are like flags that mark bacteria for destruction. The bacteria releases special enzymes that cut and break down these antibodies, especially a type called IgG. When the antibodies are destroyed, your immune cells have a harder time recognizing and attacking the bacteria. This allows the bacteria to stay in your throat longer and multiply more easily. Another trick involves surface proteins on the bacteria that grab onto the part of the antibody called the Fc region. Normally, this part helps immune cells identify and engulf bacteria. But when the bacteria bind to it, they block the immune system from tagging them properly. This process, called blocking opsonization, prevents immune cells like macrophages and neutrophils from doing their job effectively. So, the bacteria can avoid being eaten and continue to infect the tissue. The bacteria also produce a slimy capsule made of hyaluronic acid. This capsule makes the bacteria look similar to your own tissue, helping them hide from immune detection. It's like wearing a disguise that makes it harder for your immune system to see them as threats. Additionally, the bacteria can release molecules that interfere with immune signals, such as C5a, which normally helps recruit immune cells to fight the infection. By disrupting these signals, the bacteria limit the number of immune cells that arrive at the infection site, giving them more time to survive and multiply. Some strains of strep throat can even use fragments of red blood cells to cloak themselves. By binding these fragments to their surface, they create a shield that makes it even harder for immune cells to recognize and attack them. In summary, strep throat bacteria have multiple strategies to escape our immune defenses. They produce enzymes that destroy antibodies, use surface proteins to block immune recognition, wear disguises like capsules, interfere with immune signaling, and even hide behind fragments of our own cells. These clever tactics help the bacteria establish infection and sometimes cause more serious complications if not treated properly. Compared to influenza, which changes its surface proteins rapidly to dodge immunity, strep throat relies more on direct interference with immune proteins and cells. Understanding these mechanisms highlights how different pathogens have evolved unique ways to outsmart our immune system. Always remember, if you suspect a strep throat infection, consult a healthcare professional for accurate diagnosis and appropriate treatment.